Meet Patrick, a 68-year-old retired teacher. He arrives in the ER hunched over, coughing up thick yellow mucus, flushed, exhausted, and clearly struggling. First, let's notice what matters. Patrick has a productive cough, meaning sputum filled with inflammatory debris. He's febrile, breathing fast, and short of breath. He has crackles in his lungs, a wet sound caused by fluid where air should be. He's mildly confused, a red flag that often signals low oxygen. His oxygen saturation is 91%. His respiratory rate is 26. His temperature is 102 Fahrenheit with a heart rate of 128. A chest X-ray shows consolidation, a white patch where air-filled lung should appear dark. His white blood cell count is elevated, indicating bacterial infection. A sputum culture will identify the cause, and a blood culture checks whether the infection has spread to his bloodstream. Now let's interpret. Patrick has pneumonia, an infection of the alveoli, the tiny air sacs responsible for gas exchange. Under normal conditions, oxygen moves easily from these sacs into the blood. In pneumonia, bacteria trigger an immune response that floods the alveoli with fluid and pus. Oxygen cannot cross. The hypoxia explains his rapid breathing and confusion. Why does this matter? Oxygen is life. Patrick can deteriorate quickly if no one intervenes. Next, we respond. The curative treatment for bacterial pneumonia is antibiotics. If the pneumonia turned out to be fungal, we'd add antifungals, viral, antivirals. But in most cases, antibiotics are the answer. At the same time, we support his body. Supplemental oxygen raises his saturation, antipyretics to bring down his temperature, mucolytics to thin secretions, and bronchodilators to open airways. We encourage rest and extra fluids. Finally, let's reflect. Improvement means rising oxygen levels, slower breathing, falling fever, clearer thinking, and thinner sputum. Worsening vital signs with ongoing confusion raises concern for respiratory failure or sepsis. In summary, pneumonia is an infection of the alveoli. Bacteria infect the alveoli, the immune response fills them with fluid and pus, so oxygen can no longer cross into the blood, and cells are starved of the oxygen they need to survive. Most common symptoms are a productive cough with sputum, difficulty breathing, decreased oxygen saturation, and fever. Most likely curative treatment are antibiotics. If you study to remember, you will forget, but if you study to understand, you will remember. Author unknown.